If I may convene us, so we can stay on schedule for online. Good morning, or good afternoon, good evening. My name is Sandro Galea. I have the privilege of serving as Dean at the Boston University School of Public Health. On behalf of our school, welcome to this public health conversation. These public health conversations are meant as spaces where we engage with the ideas that help create a healthier world. We welcome speakers who lead us in discussion about issues of consequence for health. Thank you for joining us for today's event in person and online. In particular, thank you to the Dean's Office and the Marketing and Communications teams, without whose work these conversations would not take place. In recent years, we have seen an increase in mental health challenges among young people. These problems in many ways intensified during COVID. Additionally, social media and smartphones have created new challenges for the mental health of this population. The scale of this challenge reflects the importance of engaging with mental health at the level of public policy to create systems that support better mental health for all. Mental health is public health, and supporting mental health is core to everything we do and core to our school. At the school, we have recently launched a Center for Trauma and Mental Health dedicated to researching and developing public health strategies to address the health consequences of stress and trauma. I'm very much looking forward today to our guests talking about how we can continue to advance progress on this issue, shaping a better status quo around mental health. To discuss this topic today, we are privileged to welcome Massachusetts Senator Edward Markey and Surgeon General Vice Admiral Dr. Vivek Murthy. We are pleased to welcome these distinguished guests to our community. Following opening remarks from Senator Markey and Dr. Murthy, the two will engage in a conversation on promoting mental health among children and youth, and then they will take questions from our audience both in person and online. For our audience, there are pieces of paper where you can write questions, and there will be runners who will take questions on paper, which will then be passed on to the stage. I now have the honor to introduce Senator Ed Markey. After serving for 37 years in the U.S. House of Representatives, Senator Markey was elected to the U.S. Senate in a special election in 2013. He has a prolific legislative record, engaging with a range of major issues, including climate change, clean energy, safeguarding privacy, nuclear nonproliferation, investor protection, and preserving an open internet that spurs competition and consumer choice. A member of the Commerce, Science, and Transportation Committee, Senator Markey is a national leader on telecommunications policy, technology, and privacy. Senator Markey is also an excellent representative from Massachusetts, really privileged to be in the state, Senator. Following his remarks, Senator Markey will introduce and welcome Dr. Murthy to the stage. Senator Markey, over to you.
Thank you so much. Thank you so much, and good morning. Our thanks to the terrific team at the Boston University School of Public Health, including Meredith and Erica, for their work to bring us together here today. And thank you, Dean Galea, for that warm introduction. Dr. Galea, we are grateful for your leadership, advancing innovation and education in public health and mental health across the Commonwealth, the nation, and the world. Among his many contributions to the field, Dr. Galea is the chair of the National Academies of the Sciences assessment of the impact of social media on health and well-being of adolescents and children in our country. He is a titan in the field, and while he already has tremendous accomplishments, to his credit, we hope and expect he will continue to build upon his important work. Dr. Galea, there is clearly so much left to do that requires your vision in this field, and we thank you so much for everything you do for our country. Thank you so much. Many Massachusetts leaders from our healthcare, education, and justice systems are joining us virtually and in person, stretching from Cape Cod to the Berkshires as a reflection of our dedicated statewide network of service and care. Thanks also to State Representative Marjorie Decker for joining us here in person today. We thank you so much for all of your work up in the State House. And I know that Senator Patrick O'Connor and Representatives Joe McGonigal, Kip Diggs, and Bill Driscoll are also participating online here today. And a special shout out to BU School of Public Health alum Lisa McClure, who leads my Senate healthcare work in my Boston senatorial office. So Lisa, where are you? Please stand up so people can see what a BU healthcare public school of public health leader looks like. We're very proud to have her. And I'm honored to be here in conversation today with a national leader, Vice Admiral Vivek Murthy, the 21st Surgeon General of the United States. He is on the front lines of fighting the youth mental health crisis, addressing the risk of social media in our kids, and taking on this scourge of sadness and pain across the country. We are fortunate that Dr. Murthy has called Massachusetts home, including when he was an internal medicine resident at Brigham and Women's Hospital. We have worked together for many years on solutions to the greatest public health challenges our country faces: the opioid epidemic, the coronavirus pandemic, and now the youth mental health crisis. So we thank you, Dr. Murthy, for joining us today here at the BU School of Public Health. Thank you so much. And I might just add, my wife was Assistant Surgeon General of the United States and a 2-star admiral in the public health service. Dr. Murthy is a 3-star admiral. But I, as a former specialist force class in the United States Army, I knew, and I still know 38 years later, how to salute a 2-star admiral at home. And much of what I'm going to be talking about is just informed by those conversations at the dinner table for 38 years, talking about all of these issues. She was the chief of behavioral medicine at the National Institutes of Health when I met her. So today, young people are burdened by the challenges that generations before them caused and refused to solve. They are watching their communities brought down by rising sea levels and intensifying storms fueled by climate change. They have lost connections and loved ones to pandemic. They've watched their parents balance the bills, sometimes succumbing to bankruptcy and even homelessness due to medical bills. Schools, once the place of refuge for our kids, have become training grounds to run, to hide, or even fight in the face of preventable gun violence. They are losing their parents, their siblings, and their friends to fentanyl and to opioids. And even when our young people organize, mobilize, chant, protest, strike, or plead, our progress on these challenges is too slow, too incremental, and simply too late. We've put the weight of the world on the shoulders of our young people, and it is making them sick. According to the Centers for Disease Control and Prevention, 1 in 3 high school girls contemplated suicide in the past year, up 60% from a decade ago. At least 1 in 10 girls attempted suicide in the past year in the United States of America. 1 in 10 girls. Among LGBTQ youth, the number was more than 1 in 5 attempted suicide last year. Emergency department visits for opioid-related overdoses increased by 41% for boys and 10% for girls aged 12 to 17 in the fall of 2022 compared to the year before. In 2021, 16% of students in Boston seriously considered suicide. In 2021, 16% of students in Boston seriously considered suicide. And a recent study found that teens aged 12 to 15 who spent 3 hours per day on social media face double the risk of poor mental health. Outcomes like depression and anxiety. This is real, it is happening, it is right now. The ubiquitous smartphones and social media apps exacerbate the mental health challenges young people face: social disconnection, isolation, insecurity, self-esteem. To put it plainly, big tech is a big problem for young people in the United States of America today. Big tech CEOs are leveraging data about kids and teens and using it against them, serving up an endless stream of toxic content that grabs their attention and keeps them scrolling. And that's why I'm proud that at the end of last year, Congress passed into law my legislation to finally fund at the National Institutes of Health and Department of Health and Human Services research on the impact of technology and media on children and teens. I was able to secure $15 million so that this research finally could be done by the federal government, dedicated to this research initiative, and I aim to continue to build on this foundation. We need a definitive statement by the federal government of the impact that social media is having upon the children in our country. And that $15 million I've been able to secure is now beginning to do its work and the research at NIH and HHS. But sadly, when kids start to show signs that they need help, it is often lacking. Of the more than 100,000 psychologists in the United States, only 4,000 are child and adolescent clinicians. For every 1,200 students, there is only one school psychologist. We simply do not have enough therapists for them. The wait for substance use disorder treatment is long. Educators, school administrators, and social workers try their best, but without more training and resources, they are left to do too much with too little. But even in these dark days, the strength and resilience of children and teens are a beacon of light. They can and they do build communities online, creating a future that is inclusive and equitable for trans, disabled, Black, and brown kids. They encourage each other to talk about their mental health struggles without stigma and shame. They are standing up to demand a healthier planet and safer schools, and they are making clear that the fight for a more just future marches forward. And we will march forward. History has shown us that we can. We added seatbelts and car seats to vehicles to make children physically safer. We added child-proof caps to pill bottles to make sure that children were protected. Today, our charge is to improve and protect their mental health. And there are solutions. First, we have to legislate and pass my bipartisan Children and Teens Online Privacy Protection Act, also known as COPPA 2.0, to stop the big tech data practices that are contributing to today's youth mental health crisis. And that means in this legislation, and my goal is to get it passed this year, one, banning advertising that targets children. If a 13 or 14-year-old girl with bulimia or anorexia goes online to get information about that disease, she should not be targeted then by advertisers that will only exacerbate that problem. Two, creating a digital marketing bill of rights for teens. And three, creating a youth marketing and privacy division at the Federal Trade Commission. We must invest in community health centers and community-based mental wellness and resilience programs to guarantee care is available when and where it is needed. And we must empower public health departments and clinicians in order to ensure that they get the resources which they need in order to deal with this crisis so that we get the help to where the problems are. Young people are 20% of the problem, but they are 20% of the population, but 100% of our future. If we are asking them to be resilient and work for a better tomorrow, then we must give them the tools to do it. We can follow their example by working together to meet this moment. So we thank you, Dr. Murthy. We thank you, BU School of public health for all of the work which you are doing on this issue, and everyone who is in this room. We need a national conversation on how to put in place the safeguards that are needed in order to protect these young people. As the great Coretta Scott King said, the failure to invest in young people reflects a lack of compassion and a colossal failure of common sense. Let us invest in those solutions that will give our children and young people the healthy, just, livable future that they deserve. And we don't have in this country a greater champion for public health, for the protection of the young people, to give them the tools which they're going to need in order to survive and thrive in a 21st century country. We have with us today one of the great leaders in our country. We welcome you, Dr. Vivek Murthy, to this great gathering. Thank you so much. Thank you, my friend. Thank you.
Well, thank you so much, Senator Markey, for those kind words, and more importantly, for all of your leadership on issues related to mental health, not just during your time in the Senate, but from when you were in the House as well, representing our state of Massachusetts. I want to thank Dean Galea and the entire School of Public Health here for giving us this opportunity to have a conversation about an issue that I firmly believe is the defining public health issue of our time, and that is a mental health crisis in America. And on a personal note, I'd say it is just wonderful to be back in Boston. As Senator Markey alluded to, I spent many years here. I was here for college. I was here for my medical training. I stayed on for a number of years afterwards as a faculty member and as a physician at Brigham and Women's Hospital. I lived just a few miles away from here in Brookline. Came by here, this part of town, all the time, and it feels good to be back. I also want to recognize Senator Markey's wife, Dr. Susan Blumenthal, who in her own right is a public health leader, somebody who has dedicated herself to improving health and well-being in our country for decades. I'm so grateful that she was a member of our Public Health Service Commission Corps, which is one of the uniformed services in the U.S. government, one of the 8, in fact, and the one that is solely dedicated to health, the one that the Surgeon General is privileged to be able to lead. But to have her as one of our 2 stars is certainly a privilege. And lastly, I learned who my commanding officers were when I had the chance to serve during my first stint as Surgeon General. My 4-star at home is my wife and my 2 kids who are 5 and 6. They tell me what to do. I salute, I say yes, and I move forward. They're beautiful, they're wonderful, but I mention them because they're an important part of why I'm here today too. Because I'm here not just as Surgeon General, but as a husband, as a parent of 2 small children who's looking at what's happening to kids in our country and who's deeply worried about what's going on. You know, my kids are young, and I still remember what it was like when my wife and I first learned that we were going to be expecting our first child. For those of you who may have been in a similar boat at some point in your life, you know that's a moment that you'll never forget. But I know in the days that followed, that moment, we got a lot of advice from friends. One piece of advice we got was that your kids will sometimes listen to what you say. They'll more often listen to what you do. So make sure you set a good example for your kids. But the one that I think about often is the advice we got that signing up to be a parent is signing up for a lifetime of joy, but also a lifetime of worry. And that even when your kids are past 18 and they're out of the house, you're going to be worried about them. But you do it because the joys are so great. And as I've talked to parents all over the country as I've traveled, I felt that joy, but I've also sensed that the worry has been increasing because parents everywhere are seeing kids in crisis, whether it's their child or a child at their kid's school. They're worried. They see more kids who are attempting self-harm, more kids who are lost to suicide. They see that depression and anxiety have become all too common among young people. They're also looking at the new forces in children's lives, like social media and technology, which parents didn't have to deal with when they were growing up, and which are rapidly evolving, fundamentally changing how our kids see themselves and each other in the world. And yet the entire responsibility for managing that has fallen on the shoulders of parents. and that is not a reasonable thing. And so I sense this worry from parents, and for good reason, because when we look at the statistics as well, we see that the numbers bear out what parents are concerned about. You know, in the decade prior to the pandemic, we had a 57% increase in the suicide rate among young people. In the decade prior to the pandemic, and the pandemic has poured fuel on a fire that had been burning for a number of years. But we also see, as Senator Markey was mentioning, some of the recent CDC stats, that in 2021, 1 in 3 girls seriously considered taking their own life. 1 in 3 adolescent girls. That should not be happening. That should not be happening anywhere, and it should not be happening in the United States of America, where we recognize that our kids are our most important investment, their most important charge. It's not just a general responsibility, it's a moral responsibility we have to take care of our kids and the next generation. And through stories and statistics, our kids are telling us that we are falling short and we need to do better. And that's why we're here today. Now, it's not all doom and gloom. When I think about what's happened in the last 2 years in particular, in terms of the investments that we have made in mental health, in terms of the bipartisan growing sort of, I would say, partnership that we have to move forward on extending access to care and investing in prevention, when I think about how much awareness there is in the population now, in part driven by young people who have chosen to think and talk differently about mental health than prior generations, I feel encouraged, because this is something I had not seen in almost 30 years that I have been in public health. So there's a lot more happening now than ever before. But we need to do more, because time is of the essence. Kids only get one childhood, and every day, every week, every year matters for a child and for their development. And that's what we're here to talk about, is not just what needs to be done, but how we can start doing it. And ultimately, tomorrow depends on today, on what we choose to do today, on how we choose to talk differently about mental health and the urgency that bring with it. Tomorrow also depends on the investments that we make today, not just in treatment, but in prevention. And I say this in particular because as a country, we have been so much better at treatment in general for illness than we have been at preventing illness in the first place. But we cannot afford to let our investments in prevention fall further and further behind. So that's what we're here to talk about today. And I will just say, you know, again, not just as a public servant, but as a father, that I want the world to be better and more secure for my kids and for your kids and for all of our kids. I want our children to be able to grow up in a world where if they need care, they can get it, and they can get it quickly, where they don't feel ashamed to ask for help or think that somehow it's their fault or they're broken if they're struggling with anxiety or depression. But I also want them to know that they're growing up in a compassionate society where people care about them, where others are looking out for them, where if they stumble and fall, there are people who will reach out and extend a hand to lift them up, and where they understand it's important to do the same for others as well. That is what we need, but it's also what we can build together. We just have to decide that this is what we're going to do. And today we're here to talk about how we go about starting that journey. So I'm grateful to be here with you for this conversation. So grateful to our hosts, and especially to Senator Markey for being our conversation partner. Thank you all so much.
So thank you, Dr. Murthy, so much. Let me just begin by asking you to reflect upon those statistics in terms of young people and their actually attempting suicide or thinking about attempting suicide, and maybe just lay out what you think are the real issues that we're going to have to deal with if we're going to reduce those numbers significantly in the years ahead.
Absolutely. Well, and let me also say why this is so important to all of us here, because mental health is not just one more issue to add to a long list of health issues that we're dealing with as a country. Mental health is the fuel that allows us to show up in our lives, for our family, for our friends, in our workplaces, in our schools, in our communities. When kids and adults, by the way, struggle with their mental health and well-being, it impacts all dimensions of their life. And that's why what we've got to recognize is that investing in this is not just about mental health. It's about physical health. It's about productivity. It's about making sure our kids get the most out of their educational experience. It's about ensuring that people participate and engage in society. All of that is worse when people struggle with their mental health. Now, some of the numbers that Senator Markey and I were talking about that speak to the depth of this crisis right now among young people, they're out there, they're public, but they're worth underscoring. The number 1 in 3, of adolescent girls who consider taking their life in 2021, that is an extraordinary number that we should never allow ourselves to get used to or numb to. When we also recognize that nearly half of high school students in America are saying that they feel persistently sad or hopeless, at a time where we hope that young people are feeling optimistic and excited about the future, that is another major red flag. Sometimes people say, well, are these numbers just the fact that young people are more willing to talk about mental health and admit that they're struggling? And I'd say, no, this is not entirely explained by that. That might explain perhaps more people reporting that they may have struggles with their mental health and well-being. But what we're seeing is sharp increases over the last decade or so in hospital visits, emergency room visits for psychiatric emergencies. We're seeing a rise in the rate of attempted suicides and completed suicides. This does not happen just because people are more willing to talk about the fact that they're struggling with a mental illness. So there's something real happening. And to really get to the root of it, as Senator Markey was saying, we've got to understand where this is coming from. And one thing I want to be super clear on is this is not just every generation having its usual struggles with growing up, right? We do know that middle school is hard, for a lot of generations, right? It was hard for me. It's probably hard for the generation before me and the generation after me. Change is always difficult. Growing up's never easy. But there are a set of circumstances that young people are dealing with today that are different on top of all of that. Like they are dealing with the increasing and deepening threat of climate change, which many of them speak about and talk about, and they worry that they're not seeing enough action on it. And so what they ask about is the future really brighter than the past? Because they see these existential threats going unaddressed. They also, though, are dealing with trauma, and trauma in particular from violence. Gun violence has now become the #1 cause of death among young people in the United States of America, the #1 cause of death. That was not true when I was growing up and when most of us were growing up. It is true today. And that trauma is profound. It can last for years, not just for a child, but for their family as well. Many young people are also struggling with loneliness. Earlier this year, in fact last month, my office issued a Surgeon General's advisory on the growing crisis of loneliness and isolation. And one of the things we pointed out is that 1 in 2 adults in America are reporting measurable levels of loneliness, but the numbers are actually highest among young people. And so loneliness, we know, increases your risk of mental health concerns. In fact, social disconnection increases the risk of depression, anxiety, as well as suicide.
Can you talk about how it seems like a paradox, because the internet connects young people to their friends, to a world that can help them to avoid isolation, and yet the more that they're online is paradoxically the more they feel isolated. So can you talk about that and this inherent paradox that there's a Dickensian quality to it, that it's the best of wires and the worst of wires simultaneously, that it can enable, it can ennoble, but it can also degrade and debase and do it all. So talk about that paradox in terms of young people feeling isolated even as they're in an interconnected world.
Well, I'm really glad you raised that, because this is actually the #1 question I get from parents as I travel around the country. They ask, is social media safe for my child? They want to know if social media and if their use of technology is hurting them. And you're right that this is a bit counterintuitive. Like, we think about technology as connecting people. Social media in particular, many of these platforms are designed to strengthen connection. But what we're finding is actually, and this is literally what young people are telling us directly, and is they're telling us it's not exactly working out that way. While social media can have some benefits for some kids, helping them feel more connected, giving them a chance to have a voice in a larger platform, finding community, sometimes in times when they may not be able to find one as easily offline and in person. We know that those benefits can be real. But we also know is that for many young people, there are harms that are associated with their use of technology. So the most common thing young people tell me when I travel around the country about social media is they say, number one, it often makes them feel worse about themselves as they compare themselves constantly to other people and then despair. And that compare and then despair, that cycle just repeats. Second thing they often say is it makes them feel worse about their friendships. Interestingly, they see their friends online doing all of these things without them, and they often feel left out. But the third thing they say, I think, is also quite telling, which is that they can't get off it, right? Because the platforms are often designed to maximize the amount of time that our kids and that all of us are spending on these platforms. But what I care about as a parent and as a doctor is maximizing the health and well-being of my kids and all of our kids. The platforms need to be designed for that outcome, but the fact that they're designed to maximize time is reflected in what we see, in the sticky features and infinite scroll, and the fact that you can use these platforms if you're a child all around the clock. And that's why it also worries me that 1 in 3 adolescents are now saying that they stay up till midnight or later on weeknights rather, on their screens, and that's predominantly time using social media. That's concerning because if our kids are being robbed of sleep, sleep deprivation is another risk factor in terms of mental illness, and that increases their challenges with overall growth and development. So the bottom line is technology at the end of the day is a tool. It can help us or hurt us depending on how it's designed and how it's used. My worry right now with technology and with social media in particular, as I stated 2 weeks ago when we issued an advisory on this topic, is that there are not adequate safety protections around social media platforms that help kids and parents. When a parent is looking for a car seat, as my wife and I were a few years ago, and we still use car seats for our kids. When you're looking for toys for your kids, when your child turns 15 or 16 and you're thinking about allowing them to drive and to get into a car, there are safety standards that leaders in government like Senator Markey and others have put forward over the years that manufacturers have had to adhere to. We don't tell a parent, you know what, your child's ready to drive? Why don't you go out and inspect the brakes by yourself? Go ahead and check the frame out, test it to make sure it's adequate in case there's a collision. Look under the hood and check out the engine. We don't tell a parent to do all those things because that's not a reasonable expectation. And here too, when you've got platforms that are rapidly evolving, where you've got some of the best product designers in the world who are using the latest in brain science and behavioral science to design platforms that maximize the time of use, to tell a parent and a kid, just rely on your willpower to somehow manage your use of that platform, that is not realistic, it's not reasonable, and it's not a path toward good health. And that's why some of the measures Senator Markey was alluding to earlier in our event, the combination of safety protections that will protect a child's privacy, that will also protect them from exposure to harmful content, from harassment and bullying, and from features that manipulate them into excessive use. All of these are important and essential when it comes to policymaking.
Yeah, so when I was a boy growing up here in Boston, it was a different time, no question. Mothers were home, and school recessed at noontime so all the children could go home. It's a different era. But on Boston television, on Channel 4, WBZ TV, every noontime, on came Big Brother Bob Emery, and every child in Greater Boston watched it. And Big Brother, each day, you'd go home and watch cartoons in the middle of the day before you went back for your afternoon classes. That's how it was in Boston when I was growing up. And Mom was home. And Big Brother, each day, he would urge all of us to tell our mothers to buy a big jar of Bosco so that we could put it into a big glass of milk. And then we would look at Dwight David Eisenhower and the American flag floating in front of his face as they played Hail to the Chief, and we would toast to the President of the United States. So kids, make sure you get your mom. And then we would cut and we'd all chug-a-lug a glass of milk with Bosco every single day, all over Greater Boston. So it came to pass that Den 9 of the Cub Scouts in Malden that I was in, we were in the peanut gallery. And we're wearing our uniforms, sitting there, and Big Brother says, and make sure you tell your mom to get a jar of Bosco so you too can toast to the President of the United States. And then Big Brother lifted up his glass of milk with Bosco in it, and we're looking at him. And as they're playing Hail to the Chief, he puts it down without drinking any of it, and he picks up an empty glass. Big Brother does not chug-a-lug a glass of Bosco every single day. Okay? So I was looking at it and saying, what a ripoff. Big Brother is lying to us. He's marketing to me, a 10-year-old, to harass my mother. And so in the 1980s, I became the chairman of telecommunications in Congress. And one of the very first things that Ronald Reagan did with his chairman of the Federal Communications Commission was to take all of the children's advertising protection laws off of the books. And the chairman of the Federal Communications Commission said that a television is nothing more than a toaster with pictures. It's nothing special, as though it was just another inanimate object in the house, when we all know that a television is not a lot more than just a toaster with pictures and its influence on our society. Well, I was able to get all those laws put back on the books that have been passed to protect children in television advertising. And they're still the laws today. But in social media, they have escaped that responsibility. So as the author, the principal Democratic author of the 1996 Telecommunications Act, and by the way, in 1996, not one home in America had digital. So it's not that long ago. Not one home had digital in 1996. And it rapidly expanded across the country. And I tried to get an online privacy bill of rights, but the companies fought it. So in 1998, knowing that children are going to get targeted by these technologies, which I had learned from age 10, I was able to get a child online privacy protection law passed for kids under the age of 13 in our country. So when you see Facebook fined billions, Google fined millions, it's all under that one law. The Federal Trade Commission uses that law. But we don't have any protections for 13, 14, 15, 16, the kids we're talking about right now on the books. And we have to put that protection on the books, saying, one, that parents should have the knowledge that information is being gathered. Two, notice that it's being reused for completely different purposes. And three, that you have a right to say no as a family. No, stop targeting my child, because we can see the mental health consequences of this. So it was more benign when it was Big Brother Bob Emery in his glass of Bosco that he never did drink. It's much more pernicious. It affects the mental health of children. So is it imperative that we do pass those protections for kids, for teenagers especially in our society? Because there are laws for younger kids, but none. It's not illegal to do anything to those kids who are 13, 14, 15, 16.
Yeah, and I think I'm so glad you raised that, because kids who are 13, 14, 15, especially that early stage of adolescence, they are in a different phase of development than older or younger individuals. And at that stage of development, where their brain is actively developing, their social relationships, their sense of self is developing, they are more susceptible to social suggestion and to peer comparison. And if you think about it, that is what exists in overwhelming abundance on most social media platforms. And so yes, those kids do need protections as well. People often ask me, well, you know, that question I told you I was getting from parents, the most common one, is it safe? Is social media safe for our kids? It's a reasonable question to ask for a car seat, for a car, for medication. But when it comes to social media, we looked at the data, and there is not enough data for us to conclude that, in fact, social media is safe for our kids. But we should be demanding the same kind of safety, especially at a time when 95% of our kids are on it, and when we are in the middle of the worst youth mental health crisis in recent memory. We should be demanding these kind of safety standards. And lastly, I'll just say this. Some people will sometimes say, well, the toothpaste is out of the tube already. Everyone's already using it. What can we really do now at this stage? I reject that notion for this reason. When we made sure that there were safety precautions in cars, when we put seatbelt laws, into effect, cars were already on the road. Nobody said, cars are already out there. What's the point in trying to make them safer, right? When we recognized that we were losing so many kids to drunk driving accidents, no one said to Mothers Against Drunk Driving, you know what, it's already happening. There's no point in trying to address this and put the toothpaste back in the tube. We did what we needed to do to protect lives, and that's what we have to do here. The platforms may already be out there, they may be used by a lot of people, but we have the power and I believe the obligation to take steps to make them safer, as we have done in the past. This is what we're talking about here is not something horribly unusual or a major departure from precedent. This is doing what we have always done in our country, which is to recognize that we've got to protect kids, we've got to prioritize their well-being, and whatever steps are needed to do that, those are the steps we've got to take.
Yeah, and it's not going to be easy. This is going to be a fight, and we should have the fight this year. This should be the defining year. People complain about the legislative process because it's a failure. And then it's a failure, and a failure, and a failure. And then finally, the system works. And the system works because people stand up and they demand action. That's what happened on climate change last year. That's how we got the $369 billion for wind, solar, all-electric vehicles, batteries. Finally, people stood up, and finally, we were able to get that passed. Well, we need the same thing to happen this year in the United States Congress. This is an absolute crisis that has to be dealt with. And the auto industry, I was on the committee. The auto industry did not want airbags. They said people don't want airbags. Okay? And then finally, they got forced to put an airbag in for the driver of the car. Guess what happened? The person sitting in the passenger seat said, "What's that all about?" Okay? You get saved. And so ultimately, the auto industry just got pushed by the American public to putting in the airbags that dramatically impact safety in vehicles in our country. And we need an airbag for social media. We need a way in which we protect these kids. Something that parents can rely upon, that they can take action against these big companies. Otherwise, this is just going to get worse and worse and worse. And if I can just come back again, the numbers just in Boston in 2021, 44% of Boston's high school students reported feeling sad or hopeless almost every day for more than 2 weeks in a row. 16% of Boston high school students seriously considered suicide. 19% had engaged in intentional self-harm without wanting to die. So can you talk about the resources, the mental health resources for young people, and what you see as the need for those gaps to be filled with the help these young people need?
Absolutely. And so on the action front, there are a few buckets of action that I believe we've got to take. And like I was saying earlier, we have thankfully more resources over the last 2 years to start down the path of filling those buckets. One of them is regarding treatment, right? We know that too many people who need treatment can't get it and can't get it fast enough, right? What we need to do is we need to be able to use technology to more effectively get care to where people are, as opposed to expecting them to drive 30 miles and wait 3 months to get an appointment. We also need to train more mental health providers, expand our notion of who is a mental health provider. Peer counseling and support programs, for example, have been life-saving for many kids around the country, but we've got to invest and expand more of them. And then we've also got to, on the insurance side here, ensure that we are enforcing and strengthening the parity laws so that companies are not discriminating against individuals who need mental health care. Because traditionally this has happened, and the parity law passed in 2008, is still not adequately enforced around the country. So that's what we've got to do on the treatment side. On the prevention side, what we've also got, there's a lot we have to do here. And number one, we've got to get more counselors into our schools for our kids. And there were billions of dollars that came through the American Rescue Plan that schools are allowed to use to actually hire counselors, to invest in social emotional learning programs and other supports. This is all vital. And the social emotional learning, I'll comment on that for a moment. A lot of our kids don't necessarily get training or the skills in how to build and maintain healthy relationships. in their life, how to handle conflict, how to understand emotions when they arise in themselves and in other people. But we all know that those are really essential skills, right, for their well-being and their overall development. I actually think those skills are just as important as learning to write and do math in terms of your success in life, your overall health and well-being. But that's a place where we can invest as well. That can help also address the deepening challenge with loneliness and isolation that young people are facing. And finally, on the prevention side, this technology piece that we've been talking about is critical there too, because ultimately what we want is for technology to be able to help kids and not harm them. If social media has benefits to offer, we want to maximize those benefits while minimizing and limiting harms, right? But that means that we've got to start addressing some of these challenges and put in place protections around social media to make the platform safer for our kids. Finally, the third and last bucket I'll mention is not something that you can legislate, but it's one that all of us can play a role in addressing. And that's in addressing the stigma around mental illness, which is, arguably perhaps less intense than it was 20, 30 years ago. But it's still there. I talk to so many young people across the country who tell me that they feel ashamed to go out and ask for help because they're worried about talking the fact that they feel lonely or isolated. They're ashamed of the fact that they've attempted self-harm and don't want to talk to a friend or a parent about that. So we've got to make it easier for people to recognize that there's no shame in admitting that you need help. We ought to help people also understand that a lot of us are actually struggling. We've become experts at putting masks on, right? And walking around and making it seem like everything is great about our lives. And so other people look around and they say, gosh, I guess I'm the only one who's struggling here. But that's not the reality. We know that. I was just telling Senator Markey, I was just in Boston on Friday for my 25th college reunion. And a lot of folks actually weren't going to come to reunion because they were worried that they were the only ones who were struggling to figure out what to do with their life, and that everyone else had it all together. They read their entries like in the reunion book, and it seemed like, oh wow, everyone's like got their act together, they're doing amazing things. But then they got to reunion and they realized, you know what? Everyone is asking the same questions. They're worried, they're a bit lost, they're struggling a bit with loneliness, they're trying to figure out what to do with their lives. So that changing that stigma, changing how we think about mental health, that's a place where all of us have a role through the conversations we have with our kids, with our family members, and the issues that we choose to raise in the public square.
So during the pandemic, we learned something about a technology, telehealth, that can help. But there are issues with regard to reimbursement. I continue to meet with people who say how much they did benefit from telehealth. But what I also find is that from providers, they're saying, we don't get reimbursed enough. We don't get paid enough to do it. So can you talk about that and what we've learned over the last couple of years in terms of the role that technology can play in terms of helping individuals with mental health issues?
Yes, and this is actually a place where Massachusetts has been a particular leader when it comes to pediatric mental health. The pandemic forced us to actually use technology to provide care at a distance. And that actually might end up being one of the silver linings of this pandemic. It dramatically improved and accelerated adoption. But we are at risk of regressing to the way things were unless we, number one, make permanent the authorities that allow people to provide care across state lines, and unless we provide, as Senator Markey was saying, adequate reimbursement. You do not want providers to feel like they need to pull people back to the office in person for reimbursement reasons when the issue can be handled either on the phone or through a video conference. And so that we've got to ensure that the reimbursement is rational and that it actually allows and enables people to get care through the most efficient way possible. And when it comes to kids in particular, there's a program called the Pediatric Mental Health Access Program, which some of you are familiar with, which is utilized here in Massachusetts and some other states. But it's a program that essentially uses technology to bring mental health expertise into the primary care office. The majority of mental health care in this country is provided by primary care doctors, right? Many of them don't have enough time or resources, and in some cases training, to be able to do what they fully want to do for a patient there. And they're stuck with having to refer someone, but recognizing that the wait time might be really long. When you can bring that expertise directly into the office using telemedicine, everyone is happier. The patient, the primary care provider, the mental health provider who wants to get in earlier rather than later in providing care. And so this is a program we actually have to fund and expand our funding for, but this should be the norm.
Can you talk about that for a second? There was a big story in the Boston Globe yesterday, focusing upon an individual pediatrician trying to provide primary care for young people in his region, and how the reimbursement levels are just going lower and lower, and more people are pulling out, and that the private insurance industry is not really willing to play a role in a meaningful way in this sector, and that more and more of these young people are going on to mass health, where the reimbursement isn't enough in many instances to incentivize pediatricians to provide this care for young people. Can you talk about that dilemma and what the way out is from your perspective?
Yeah, so this challenge is real. I mean, and we think sometimes, okay, well, we don't have enough funds to necessarily provide the adequate compensation for care in the primary care office or the mental health provider's office. What happens is we end up taking on a lot more human suffering and expense down the line. When people experience worsening mental illness, they end up requiring hospitalization, or God forbid, they lose their own life to suicide. So we are paying for this, and we're paying more and more the later and later we wait. So being able to think upstream more and say, how do we reimburse more effectively and increase access points for care in the outpatient setting is essential. And investing in that prevention bucket that I was mentioning earlier in our social emotional learning programs in schools, and addressing social connection and isolation in our communities, and also addressing the potential harms of social media and other technology. This is where we've got to go in terms of upstream focus. Because if we don't, we're seeing the consequences of not doing that today, right? We're seeing our hospitals overflowing and without enough room for kids who need a psychiatric bed. We're seeing parents who are having a hard time getting an appointment to see a child. You know, we detailed in 2021 in the Youth Mental Health Advisory I issued that on average it takes 11 years from when a child has symptoms to when they actually get care in the United States of America, 11 years. And for those of you who have kids in your life, or grandkids in your life, or nephews or nieces or others, you know that the worst pain that a parent can have to endure is to see your child suffering and to not be able to get them help. And can you imagine having to wait for years without getting your child
11 years.
11 years. And this is why when I say that this is not an issue we can deal with in 5 years or 10 years, and that tomorrow depends on what we do today, this is what I mean. Like, there's real suffering accruing to kids and their families as a result of the failure to invest in adequate treatment and in prevention. So, you know, I wish I could say this is one of those issues that if we just had one single bill, focused on one single issue, we could solve the problem. It's not that. You know, as Senator Markey knows, because he's been working on this for a long time, we've got to attack this challenge from different perspectives. We've got to expand access to treatment. We've got to focus on prevention. We've got to put safeguards in place around technology. And we've all collectively got to make this an issue that we talk about, that we advocate on, because our kids can't wait.
Exactly. Thank you so much, Doctor. We have a crisis in our country. You know, when I went out on my first date with my wife 38 years ago, she had just been put in charge of something called Project Depression at the National Institutes of Mental Health. So she was given the job of beginning this process of destigmatizing depression in our society 38 years ago. And we've come a long way, but we haven't gone far enough. Right, and the resources still have to be dramatically higher, and we have to make the social media companies accountable for what they're doing to the mental health of young people in our country. So we're at a crossroads right now. In a lot of ways, TikTok and that whole TikTok crisis has helped to illuminate this and educated Congress, I think, to a very significant way. But whatever TikTok does on a daily basis with kids in our country, it's no different than all of the American companies are doing as well. So it's not a Chinese technology company's creation. It's something that they're modeling after what American companies were already doing to American children. So that's why we need a comprehensive piece of legislation that passes this year and increased funding for mental health services as well. So we have questions. Would you mind to take some questions from our great audience here? I'm going to begin with Jamie Gratis from the BU School of Public Health. If you are here, Jamie, love to, do you have a microphone, Jamie? All right, please. Yeah, come on up here just a little bit, Jamie. Jamie, can you walk up here a little bit, Jamie, so that,
have it.
come on up,
Thank
Jamie.
you.
Yep, come on up,
Thank you.
come on up.
Good
No, so
morning.
that I want the cameras to be able to see you. Yeah, go ahead, please.
Okay, thank you so much. Jamie Gratis. I'm a professor at BU School of Public Health. I'm the director of the new Center for Trauma and Mental Health here at the school. Such an honor to have you both here. Thank you so much for all of your work. I really enjoyed reading the advisory report and especially the recommendations for different groups about what can be done about social media and kids' mental health. There are recommendations for anyone who didn't read it for policymakers, for kids and families, for researchers, for technology companies. I'm also the mom to an 11-year-old daughter who luckily is very open with me, but one thing I have learned already is that kids are using forms of social media that we cannot even begin to imagine exist. And she tells me about these different things her friends use, and it's pretty scary. So I guess that all leads me to a larger question, which is, how can we ever sort of get ahead of the lightning fast pace of how these things are evolving? And to what extent should we be intentionally advocating for groups like policymakers and researchers and the kids themselves to work together to improve these issues? Thank you so much.
Well, thank you for that question. And look, I think that you're asking the question a lot of parents have today, which is, what do I do? I can't even keep track of all of the apps and platforms out there that my kids are using. My 5-year-old daughter is in preschool. She's finishing preschool next week. And she came home a few weeks ago and asked my wife and me about posting a picture on social media. She's in preschool. Needless to say, she doesn't have a social media account. But this is what her classmates are actually talking about. So this is coming at us earlier and earlier. And I do think it's essential that we do work together as parents, as policymakers, with community organizations to address this, because this is too much for one individual or one family alone. Here's what I often recommend to families specifically. If you have a child who's not yet on social media, my recommendation would be, and this is what we're planning to do for our kids, is to, as much as you can, try to delay the age at which they start using social media. I personally do not believe 13 is safe for a child to use social media in its current form, based on all the data that I have seen. But so for our kids, we're planning to wait until after middle school, and then we'll reassess when they get to high school based on the safety standards, based on the evidence around safety and harms, and also based on their own maturity and development. But the other thing that I'd recommend for families, if your kids are already using social media, is number one, to start having conversations early with your kids about their experience with social media. You want to know as a parent, what are they using? How does it make them feel? And you'll often find that actually young people have a lot of insight into how it's making them feel. A lot of times they know it's not making them feel good about themselves, but they don't know how to stop or what to do about it. And you also want to know how they're using it. We know, for example, that we don't want our kids to get harassed or bullied online. But a lot of them are experiencing that. We want them to know what the red flags are and when to say, hey, I need help, to feel comfortable coming forward and asking for it. So starting that conversation is important. Second, you can also try to identify what I think of as tech-free zones in your child's day to protect the activities that we know are essential for their growth and development. That includes sleep, physical activity, and time in person with other people. And that could look like setting the hour before bedtime and throughout the night as a time where they can't have their phones with them. It could look like setting meal times as tech-free zones, but that can help protect your kids as well. And the last thing I'll suggest is to reach out to other parents to find partners so that you are not alone in this journey. I know that for my wife and I, it's not going to be easy for us to delay our kids using social media. And if our kid is the only one, who's not on social media, they might even feel lonely and left out, right? And so we don't want our kids to feel like that. But if we're going to be looking for other parents who are similarly oriented to say, hey, can we maybe work together on this? Can we help each other out? And then our kids also won't be alone. And when I talk to parents around the country, I'm also surprised a lot of them actually aren't talking to other parents about their struggles with their kids in social media. Because from the outside, sometimes it seems like other parents and families have figured it out. They've all got it down, and that you're the only family or the only parent who's struggling. Let me just tell you, that is not the case. Almost every parent out there is pulling their hair out, trying to figure this out. 70% of parents today say that parenting is harder than it was 20 years ago. And the top two reasons they cite are technology and social media. So there's power in numbers. We've got to support each other as parents in these efforts.
Beautiful. Next question, Jim Vetter from the Social Emotional Learning Alliance. Are you here, Jim? Yeah, please come over. Need a microphone for Jim?
So Senator Markey, Vice Admiral, Dr. Murthy, really appreciate the focus that you have, not simply on addressing the emergency with crisis response, but also focusing on promotion of mental health. I'm Jim Vetter. I serve on the Massachusetts Community Behavioral Mental Health Promotion and Prevention Commission, and am with the Social Emotional Learning Alliance for Massachusetts, Social Emotional Learning Alliance for the United States, and Education Development Center. You may be aware there was a congressional briefing just a few weeks back where there was a researcher from Yale School of Medicine who shared just some of the very latest research on the positive impacts, exactly, Dr. Murthy, as you talked about, of social and emotional learning. And we know that social emotional learning can make significant advances in reducing anxiety, depression, and suicidality. And I'm wondering, what can we do on the federal level to increase a national conversation about the importance of social and emotional learning and about promoting mental health? And what can we do to bring our agencies together in a collaboration around this effort?
That's a great question. Well, I'm happy to start there. I think what you've seen, actually, Jim, in the last couple of years, through both the American Rescue Plan funds that have been made available for these kind of programs in schools, as well as the Department of Education's efforts to actually try to support social emotional learning, is something quite different than what we had seen for the last few decades, which I think is a growing recognition that these skills matter for kids, and school is the right place for them to get it. But I do think you're asking the right question, which is how do we broaden this out into a national conversation so that parents understand the importance of this, so that they can also make choices and be advocates for these kind of programs in their schools. And that is part of what we are seeking to do through our office and our work on youth mental health more broadly, specifically on prevention. We talk often about protecting kids through addressing technology, addressing social emotional learning, and addressing isolation and loneliness. And for all of those who out here who may not be familiar with these programs, I'll tell you a very quick anecdote that for me often captures a bit of the kind of value that these programs can deliver. I was in Hammond, Connecticut some years ago visiting a program that actually had social and emotional learning integrated into the curricula. This is the Ruler program, which I know, Jim, you're familiar with. And I was talking to these three kids, who I think were in 5th grade. And while we were chatting, this other student walked by behind them, and they all glanced back at him, and then they waved at him. And then they kept talking. I said, wait, hold on, who is that kid? And they said, oh yeah, that's Johnny. He came in today and he was really angry and he was yelling and screaming and he was just really mean to us. And we figured, something probably happened to him at home. So we just let him do his thing. And then when he calmed down a little bit later on, we went back to him and said, hey, how you doing? We checked in with him, and it turned out he did have a fight with someone in his family that morning, but he was much calmer, and so now everything's good now. And then they just went on to talking about what they were talking about before. And I said, whoa, hold on. You just displayed a level of insight and emotional maturity to understand his emotions, your reaction to his emotions. You were able to mitigate what could have been a really harmful response of you lashing out. And you actually went back later and provided him support at a time where then he was able to be open about what he was experiencing. And now everyone's happy. I was like, there are adults who don't have those skills, right? But you think about how valuable it is for a child to have that kind of experience, not just for school, but for life, right? And one of the children, in fact, had transferred from another school in Connecticut that didn't have that kind of support. And she said that she was really struggling in that school, but she got to this school, and because kids understood how to manage their emotions and how to deal with each other, people were so much nicer to each other. There was a lot less bullying in the school. And she said her parents remarked to her that she seems to be so much happier and they're less worried about her. So the point is that these are skills perhaps we used to say, well, kids should get these somewhere. Maybe they should get them at home, maybe they should get them in the community. But the reality is that kids are not getting these skills on their own, right? And if we believe education should prepare kids for life, this is an essential life skill. And that's why we're pushing to talk more about it, to invest more in it, and most importantly, to make sure parents understand these issues so they can advocate for these kind of support programs in their schools.
Beautiful. Next question from Kafui Kama.
Hello. So I'm from Woburn. I just graduated the high school, so my question is kind of about the 2021 CDC Youth Risk Behavior Survey report, and 4 out of 6 variables had pointed to youth who are in the LGBTQ community, students of color, women, girls who are really struggling with mental health and suicidality. And I was wondering, like, what can our elected officials do to take action to widen access to like mental health education, healthcare, things like that, specifically in those marginalized communities for young people?
No, please.
Yeah, okay. So first of all, congratulations on your graduation. That's wonderful. And I'm so glad that you're here because we need people like you, young people who are not just leaders for tomorrow, but leaders today to help drive this conversation. If it had not been for your generation, by the way, I think we would have much more stigma around mental health and well-being. Young people really are leading the way in showing us how to talk differently about mental health. So I'm just grateful that you're here. And I'm also really glad that you pointed out this issue around equity, right? Which is that there are communities that are harder hit. And we see that as deeply concerning as these numbers are around suicide attempts and suicidal ideation, that these numbers are even higher when you look at LGBTQ youth. And we know that among certain populations, Black populations in particular, Black youth, we're seeing a significant increase, a disproportionate increase in suicide rates as well. So part of our effort to address mental health is not just about investing more money in changing policies, it's also ensuring that the effects of those investments are felt throughout the population. And I think a bit about like our efforts during COVID-19 in the early days, during the vaccination effort, when we said, equity has to be a priority here, and we can't do what often happens, which is that it's the most resourced people who get access to the vaccines, and folks who are less resourced don't. And so we made it a focus. We measured the data. We did a lot of outreach to groups that specifically engaged with communities that were higher risk. We brought people into decision-making bodies who represented those communities, and then collectively we were able to do pretty well. In those early days, in fact, we were ultimately able to get to parity in terms of vaccination rates. And since then, we've seen some disparities emerge, and so we've got more work to do. But what those early days showed us is that if you focus on equity, if you track it, if you measure it, if you hold yourself accountable, we can actually succeed in these efforts. But a key part of it is you've got to have the right people at the table who represent those communities, helping make decisions and drive action. So that's what we've got to do here as well. And it's why, like in our office, when we travel and we do roundtables with all diverse communities, but we also ask for input from diverse communities because we need them to help shape the programs that ultimately will serve all of us.
And thank you for raising that question. This is Pride Week in Massachusetts, and we have to be the leaders. State legislatures all across the country are passing anti-trans legislation. Hundreds of bills have been introduced in legislatures all across the country. The Black Lives Matters movement is under assault in many states in our country right now. We're not just the Bay State, we're the brain state as well. So we went first on same-sex marriage in 2004. Now it's a non-issue in the country because we went first. So we have a big responsibility as a state to go first, but we should also understand that so many of these young people are being exposed to the anti-trans, these assaults upon Black and brown traditions, immigrant traditions in our country, and the young people are really on the front lines of feeling the effects of that. So we have a big responsibility. We thank you for coming and thank you for your great question. And we thank you, Doctor, for everything that you are doing. We have a real crisis in our country right now. And Bernie Sanders is now the chairman of the Health Committee in the Senate. I'm the chairman of the Health Subcommittee for the United States Senate now. Mm-hmm. So I'm putting this at the top of the list of my priorities. for the next 2 years. We have to ensure that we have those resources, and that's why I've developed a policy prescription to protect kids with 5 key elements. Number 1, ban targeted advertising to children, and to give all parents in America the right to say to the social media companies, erase everything you've gathered about my child. Stop targeting them and erase everything that you have gathered. Second, establish a digital marketing bill of rights for teens. Third, create a youth marketing and privacy division at the Federal Trade Commission. Fourth, conduct cutting-edge research to study the effects of social media on teens, building on the initiative that I passed last year for the National Institutes of Health to begin this research on the impact social media is having on young people, and to increase the funding for mental health services in our country. We just need a comprehensive plan at this time. It is a crisis, and it's been a great honor to be here with you, Doctor. You are our national leader on all of these issues, and it's a great honor to be with you, Doctor, because your work at the National Academies is now going to instruct our political, our social, and our economic system in terms of the needs for us to act. So we thank you, Doctor. We thank the BU School of Public Health for being our great host today. Thank you, sir.
Just,
Senator, you mind if I add one last thing before we close?
Please, go
Just, Senator Markey made me just think. He mentioned immigrants, and many of us, whether we came here a few years ago or a few generations ago, were perhaps tied to immigrant families in some way or the other. And my family was the same. When my parents came here, though, the reason they came here was because they hoped that America would be a place where my sister and I would be judged not by the color of our skin or the fact that we had funny sounding names or that we had an accent, but that we would be judged on our willingness to work hard, on our ideas, on our commitment to our communities. And those are the values that drew them here. Those are the values that I still believe our country aspires to. It doesn't mean that we're perfect and that we always embody those values, but to be in a place where we aspire to those values means something. And I think this moment, as hard as it is, with all the crises that we were talking about today, as deep as that struggle is around mental health, the silver lining is that if we do this right, we can move our country closer to those values. We can build the kind of community where none of our children has to grow up thinking that they don't matter or that they're less than because of their sexual orientation or the color of their skin or because of the fact that they may be an introvert or they may be struggling with their mental health. We want all of our children to know that their value is intrinsic, that it's not tied to how fancy a school they get into, or not tied to how much money they make, or how much power they acquire down the line, or how famous they become, but that their value is tied to their willingness to be kind, to be compassionate, to be a contributing member of society. Right? That is what drew my parents and generations of immigrants to this country. But it's the promise that we have an opportunity to fulfill today. And it starts with what each of us do in our day-to-day lives, by how we treat other people, by whether we choose to stand up for those who can't stand up for themselves. It has to do with the issues that we choose to speak about in the public square. It's reflected in the leaders that we choose and the kind of leaders we seek to be and how we shape and design our workplaces and our schools. All of these must be informed and driven by a core set of values: kindness, generosity, service, and friendship. Right? These are the core values that can shape our moral compass. And that compass is what we use to guide us when we're making decisions about policy, about programs, about investments, or decisions in our own life. As a reporter asked me the other day, he said, "Don't kids today have more choices than any other generation before?" And I said, well, perhaps they do, but having a lot of choices is only good if you have a way to make decisions about which choices to take in front of you, right? And to make those decisions about what path to take, we need our moral compass. right? So a lot of us intrinsically know that these values matter. Those values around kindness and generosity, service and friendship. But it is time for us to not only reflect that in our own lives more deeply, but to call for those values to be explicitly reflected in the world around us, in the leaders around us, in the programs around us. And if we do that, then we can build the kind of country that I know we all want, the kind of country our kids deserve, and one that will ultimately be embracing of everyone from all walks of life, which I believe is consistent with the highest values of our country. So, thank you.
Please, before we close, I just want to say thank you, and one more thank you actually, to the audience. We have about 1,000 people between in person and online. And we call these public health conversations intentionally because we want to bring people together who actually are engaging with these issues and making a difference in the world. So I want to say thank you to you all for being here, and thank you for everything that you're doing outside of this room. Please join me in one last round of applause to Senators Markey and Dr. Murthy. Have a good afternoon, everybody. Thank you.